So our next speaker then is Judith Dawson.
Okay, everybody, so thank you very much for me being invited today to speak to you today about whose level is it anyway, a roadmap to advanced practice, which might all seem a little bit weird. What does that all mean? And hopefully by the end of today you'll be a little bit clearer. Just to give you a little bit of background, my background is in physiotherapy. I work in Broughton PCN in Salford as a first contact practitioner, and I'm currently seconded to the Greater Manchester Training Hub to deliver a first contact practice GP ready programme. And this programme will be for our clinicians moving into roles in primary care. They might be very experienced clinicians, but having come from secondary and community care backgrounds. So I really want to sort of promote that programme to you if you're working with anybody who's new to primary care from an AHP background. So just to get a feel for the room, are there any AHPs here? 1, 2, 3, so there's not very many of us around. Are any of you working with AHPs in your practice? Again, not many. Do many of you want AHPs in your practice? The answer should be yes. Okay. AHPs are going to offer an awful lot of new developments in primary care. If this will work, I might press the right one. Okay, so allied health professions will play a significant role in supporting the demands that the NHS will face in the next 10 years, so they are necessary to primary care, and they will help deliver the ambitions of the NHS long-term plan. So what roles are they going to be? So they could be first contact practitioners, they could be advanced practitioners, they could be advanced clinical practitioners, and it is accepted that advanced practice and advanced clinical practice are often commonly used in intertwingled terms. So a first contact practitioner is somebody who works with a very specialist skill set, and they will come from various allied health profession backgrounds. An advanced practitioner is an advanced practitioner who will come from a very skilled background. And you will also see advanced clinical practitioners, which blurs things a little bit because that is a qualification in its own right. So who can be a first contact practitioner? So currently there's 5 out of the 14 AHPs that can be first contact practitioners. There's physiotherapists, paramedics, podiatrists, occupational therapists and dietetics. And these are all new to primary care AHP roles and are currently funded through the Additional Roles Reimbursement Scheme. So what is a first contact practitioner? It's a diagnostic clinician. They work at master's level with undiagnosed and undifferentiated diagnosis in their own specialism. They'll manage complexity and uncertainty at the first point of contact, and they will not be novice clinicians. They will have a minimum of 5 years postgraduate experience, and many of them, like myself, will have spent 20 to 30 years working in secondary care. Going forward, FCPs will have to be accredited for the R's monies to be drawn down in practice, and all FCPs will have to be accredited, and there's 2 routes for that accreditation process. And it will be amongst your teams that you will be sort of invited to support and supervise these pupils as they go through that accreditation process. Most of them will be willing to also help supervise you in your own personal and professional development. So there's 2 routes. There's an academic route that the HEIs are offering and specific FCP roles, and then there's a roadmap portfolio route that you might be aware of. So currently there are actually 3 roadmaps available. The new one that came out on Friday was for podiatrists. You may have seen that there is already one for musculoskeletal practice, which is where the physiotherapist is sitting. There's the paramedic one. And it's necessary for people to move through these portfolios to reach accreditation. Before they start on that pathway, they need to evidence that they can show core capability, which is classed as stage 1 in their own specialism. So for example, my stage 1 is entirely around musculoskeletal, and it's got to meet that level 7 master's level. So I have a master's in physiotherapy, and I've done lots of other core M-level work. The stage 2 is then showing that you have that capability and transference of skill into primary care. And once you've reached that accreditation process, you can be put onto the Centre for Advanced Practice. So what are these roadmaps offering? They're outlining the skills and attributes needed to help AHPs become first contact practitioners, but also advanced practitioners. It provides a clear educational pathway for AHPs, setting out the supervision and governance needed and giving training guidance for supervisors. And it provides a standard of practice and a solid governance structure around first contact roles and advanced practice in primary care. It ensures gold standard, and it's importantly putting patient safety first. So the roadmap, as demonstrated on this slide, which I can see is very difficult to see, shows that people will not move into primary care unless they've got significant previous experience in their core specialism. So that they will have undertaken an undergraduate degree and then gone on from that to have at least 3, maybe 5 years of experience in a core specialism before moving into primary care. But once they're in primary care, they need to show competence of being able to work within that specialism in that primary care area. And that's where they will be requiring support and supervision, and also helping teach and widen the experience of the wider workforce. And they will do that before they might move on to a pathway into advanced practice. So first contact practice is sitting in a transition between enhanced and advanced practice. And it's a real roadmap and development for people who are moving into primary care. So what's the difference then between an advanced practice clinician? So just to be aware, advanced clinical practice is a level of practice, and an advanced clinical practitioner is someone that demonstrates that level of advanced clinical practice. And this level is designed to transform and modernise pathways of care and enable the safe and effective sharing of skills across traditional professional boundaries. It's all based upon the multi-professional framework for advanced clinical practice in England, and this makes sure that there's national consistency in the level of practice across multi-professional roles, and it gives clear understanding to the public, ACPs themselves, their colleagues, their education providers and the employers. And what can ACPs offer in primary care? These roles are determined by the needs of the employer and how they require the level of practice to be deployed within their own setting. These ACPs will definitely have a minimum of 5 years postgraduate experience, and they will be able to demonstrate across the 4 pillars of practice. So that's leadership, clinical, education and research, and that's integral and will influence every element of their interventions. They will be multi-professional, cross-organisational and cross-boundary within clinics. And they provide multi-professional supervision, so we'll be able to support your staff in their own developments as well. So just to add a little bit of confusion out there, there's obviously, we can see that over in the far corner there, we're seeing courses for the advanced clinical practice. Obviously, an advanced clinical practice masters will show somebody has got the relevant scope to work across the 4 pillars and may have a more generalist level of expertise than, say, a first contact practitioner. And those qualifications will definitely show that they meet the capabilities for stage 1 and stage 3 of a roadmap. But it might still be necessary for people who've got an ACP to show that skill is ready for primary care, and they may still need support in developing a stage 2 portfolio. But that might be different if that particular master's involved a placement in primary care and they got the stage 2 sign-off at that point. So just to give you in summary, currently FCPs, most are new to primary care. They'll need to have stage 1 before they move into primary care, so that means they've shown core competency in their main specialism. But once they move into a primary care role, they will need to do the stage 2 roadmap and get sign-off and completed before they can become accredited. Or they may have undergone an FCP HEI qualification. Some ACPs may already be able to evidence stage 1 and stage 3, but will need to evidence that stage 2 and may still require supervision and support in practice. But some FCPs will also be advanced practitioners in primary care and be accredited as such. So basically you will need stage 1, stage 2, stage 3 to become an advanced practitioner in primary care. So like anything, a good plan is like a roadmap. It shows the final destination and usually the best way to get there. So any questions on first contact practice and advanced clinical practice?